I have many stories of many patients in my career that were very moving stories. However, there's one in particular that stands out. And to this day, if I just think about it for a minute, it's very touching. I was an undergraduate nurse at the time working in a local hospital. And this particular patient was 38 years old. At the time I first met her, she was 36, about to be 37. That's significant. So she came to her, we first got her after she had been diagnosed with breast cancer. Unfortunately, the first time she went to the doctor a year ahead of that, she had a lump in her breast, and the doctor simply told her to watch it. So a year later, fast forward 1 year, she comes to us with a newly diagnosed breast cancer. And at this point, it was no longer just contained. They had to actually excise the whole breast at 36 years old. She had 2 children. She was married and a school teacher, I believe. Fast forward a year later, she initially went into clinical remission from the chemotherapy. She had such a difficult time with the chemo throughout her course, but she and I became very close because I was always there mothering and, trying to get her through this. Fast forward a year later, she comes back and she's relapsed. This time it's metastatic, meaning that it's gotten into the organs and tissue around the breast. So her lungs were involved when it relapsed. The patient came in, we started treating her again, and by this time her lungs were so involved that she kept building fluid in the lungs, and that's called a pleural effusion. And we would literally have to go in and, well, I didn't, but interventional radiologists had to go in and actually tap her or put a needle in and pull all this excess fluid out. And it was difficult to watch her go through. And she fought and she fought. She had a lot of perseverance and determination, but in the end, almost 2 years from the time she was diagnosed, she lost the fight. So what stands out most significantly about that is the evening that she was dying. And I talked to her and tried to prepare her for that point, which I usually did with all of my patients. The evening that she was dying, I had worked 7 a to 7 p, 7 in the morning to 7 p.m., and I was about to get off. It was about an hour before time for me to go home. And all of her family was there, and I had been in the room several times. And so the last time I went in was about an hour before I was getting off. And I said my goodbyes because I knew she wouldn't be there the next day, and hugged her and so forth. And just as I was leaving, she asked her husband to come and get me. So I went down, and I'm thinking, okay, I'm tired. It's been a long day. So I went in, and she asked everybody to leave the room. And I came in and sat down on the bed and held her hand, and I asked her, what could I do for her? She said, I'm afraid. I'm scared. I said, what are you afraid of? And she said, I'm afraid of dying. So I talked to her, and I basically asked her. I never tried to force religion on anybody, but, if they chose to talk about it, we would do it. I said, do you have a relationship with God? Do you believe in prayer? And she said, yes. I said, then you have nothing to fear, because as you leave this world of suffering, you're going to go to a more peaceful place, and you're going to be so much better off. You don't have to go through all these lung taps, and you don't have to go through all this chemo. And she said, okay. And very quiet. The room was very, very dimly lit. And she said, will you stay with me? And I said, yes. So as tired as I was, that just didn't even matter at that point. And I sat there and held her hand, and she just slept away. And, if I really allow myself, I could really cry again. But I try not to have sad memories when I think about her. I try to look at that as somebody that I tried to help to, die a peaceful death. But that is by far the most memorable memory that I have in my career of caring for patients and taking care of them.